This is Channel 2 News, coverage you can count on.
One of the results of the act is that we've kind of denormalized smoking.
10 years ago to the day, a Nevada law banning smoking in most public places indoors went into effect. The impact of the Clean Indoor Air Act over the past decade tops Channel 2 News at 5:30. And since the Clean Indoor Air Act went into effect, smoking rates have dropped substantially in Nevada. Good evening, I'm Landon Miller.
I'm Kristen Remington. Thanks for being with us. It was a big deal. Remember when it happened? Despite considerable progress made over the years, there's still some challenges, though, with tobacco in our state, we've learned. Amanda Ketchlich has more on the unfinished business of policymakers. Amanda?
Yeah, the Clean Indoor Air Act is seen as a public health victory for many, but lawmakers say there's a lot of work to do going forward.
Approximately 100,000 workers in the state of Nevada that still are exposed to secondhand smoke simply by showing up to work.
Tobacco control advocates met in Carson City today to talk about how the Clean Indoor Air Act has made smoking less socially acceptable.
By taking smoking out of most workplaces, most public venues, it becomes less attractive to particularly young people.
In the past decade, the act has protected people from secondhand smoke, but cigarette smoking continues to be the second leading cause of preventable disease and death. It's known to cause cancer, heart, lung, and other chronic illnesses.
There's no safe level of exposure to secondhand smoke.
Through tobacco control, cigarette taxes, and the Clean Indoor Air Act, smoking has decreased 15% among Nevada adults from 1999 to 2014. Currently, nearly 17% of Nevadans smoke.
It's an amazing success story in the state of Nevada that we've seen both adult and youth smoking prevalence drop over the last decade.
But there's a new concern clouding our state.
When we have 30% of youth that are now using e-cigarettes, which contain nicotine, a highly addictive substance, other hazardous and carcinogenic chemicals.
Just this morning, the Surgeon General sounded the alarm on teens using e-cigarettes, calling it a public health emergency.
Exposure to nicotine is harmful to the developing brain. It can not only lead to addiction, but it can affect learning, it can affect impulse control.
A new report by the U.S. Department of Health and Human Services shows that last year, 16% of high school students reported using e-cigarettes, also known as vaping.
People need to be concerned because we do know that there's harm from e-cigarettes. And while we know that, we haven't fully documented the extent of a harm from this new product, and we don't want to experiment with our youth.
And policymakers hope to strengthen tobacco regulations in the coming years. They also want to propose legislation for e-cigarette vaping in Nevada. Covering Health Watch, Amanda Ketchlich, Channel 2 News.